Today is about health and well-being and supporting our local students who are doing PhD study into health and well-being of African Caribbean communities. Lauren, who is doing a PhD in Leeds at Leeds Beckett University, and she approached us to help her to recruit participants to take part in the health and nutrition survey. Every year I think it's Public Health England do a survey around nutrition and health for the communities, but what she's found out is that they never take into account the health and nutrition needs of African Caribbean communities, and she wanted to address that imbalance.
I've put on this health fair in collaboration with Black Health Forum as a way to recruit persons for my PhD research project. And my project is a health and nutrition survey, and I'm focusing on people who are of Black African and Black Caribbean background who live here in Yorkshire. At the moment, I'm still recruiting persons for my project, so I haven't analysed any of the data as yet. So when I'm finished recruiting, then I can, show my results and tell people what I'm finding out at the moment. But in particular, I'm looking at eating habits as well as nutrition-related health of persons who are Black African and Caribbean backgrounds. So I'm looking for people who are above 18 years old, male or female, and some of the things that I'll be doing for the project is like blood pressure checks, height and weight, BMI, blood tests, so like blood glucose, cholesterol tests, all those things are included in my project.
My name is Sobia Khan, and I'm known as the hemoglobinopathy genetic counsellor. I work for the Bradford Teaching Hospital Trust, and we're based in the community. And what our aim is to serve the community and to raise awareness in regards to sickle cell and thalassaemia. So we have 1 in 4 people from the Caribbean community that have the sickle cell trait, 1 in 10 African people that have the trait. But we find that there are white Caucasians that also carry the trait, so 1 in 1,000. So it's not the actual numbers, but anyone could be a carrier unknown to them. So the idea today is to raise awareness and to be screened and to prevent things from becoming worse than they are.
Well, from the research, it shows that people who are of Black African and Caribbean descent have poorer health outcomes. So we are at a higher risk of getting type 2 diabetes, having high blood pressure and being obese. But at the moment, there's not much current research on our current eating habits or traditional foods. So I'll be looking at that within my project so I can make the link between what we're currently eating and what our health outcomes are.
Yeah, so I'm looking at the perceptions of dementia. I'm looking at them specifically within the Afro-Caribbean community and Irish communities, especially for the older generation, because they've migrated to the UK. And with migration, their viewpoints and their cultural differences would be very different as opposed to what a British person may have. So it's just to see more about a hybrid culture and see what they've kind of come to form themselves. So it's understanding how culture influences their perceptions of dementia. So it may be that there's certain things that they did in their native countries which they've kind of brought along with them. Also in terms of living in England and the historical, it might have been discrimination that they faced. Those type of influences, how they may have kind of stopped people from wanting to access services. So it's things like that we're going to be looking into and create something for them.
The Black Health Forum project is an excellent charity organisation to raise the awareness amongst the people that we're living in the demographics of Bradford and the surrounding areas such as Leeds, Huddersfield, to promote the issues that are going on in the society that can't be raised in anywhere, and they're taking it upon themselves. Financially and physically, with all the voluntary work that everyone goes on, putting everything together and working hand in hand to raise the community issues.
Yeah, Black Health Forum in Bradford is important because at the end of the day we have nobody else to really give us that urgent push to see what things that the councils, the NHS, things they're not doing correctly. So if we're not there to push it, even from way back in the day when before Black Health Forum came, I was involved in things like that before. So it's very important that we as a group stay together and get things sorted out to help the Black people in Bradford.
Black Health Initiative is really important. I think the communities that we've got in the UK are so diverse. If each community group isn't targeted or isn't supported in terms of encouraging healthy behaviours, then we're kind of going to be not seen by the mainstream, because you kind of have to help yourself, I suppose, especially when it comes to ethnic minorities in the UK.
I'm Lauren Senior and I'm a second year PhD student at Leeds Beckett University. I'm currently recruiting persons who are of Black African and Black Caribbean descent who live in Yorkshire, so whether it be Leeds, Huddersfield or Bradford. If you'd like to be involved, you have to be 18 years and older. You can call me on 0113 812 4052 or email me at lauren.senior@leedsbeckett.ac.uk.